In this presentation, I want to highlight the key components of the home healing kit and demonstrate how you can use this in your practice to initiate or complement your rehabilitation program. These indications share a common characteristic. When injured, the craniofacial region may take several days to several weeks to return to normal function. It can be difficult to reduce muscle tensing habits and activities that strain the head, neck, and jaw in response to pain. What we are trying to do with our product is break the cycle of pain. Muscles tense in response to pain, and as they become tighter and tighter, a person can become unaware of muscle hypervigilance. The pain can spread to other areas and become referred pain in the temples, neck, and shoulders, or a patient can develop trismus, where the jaw muscles can't open or remain open, commonly referred to as lockjaw. Patients come to our practices who could have successfully been treated with the Speed2Treat home healing kit, but instead they waited, went to other specialists with no benefit, and much later came to our office. This is enormously stressful for the patient, and often recovery requires multiple appointments and more treatments, such as pain medications or injections. However, it is our experience that many patients receive inconsistent care or no care at all. People don't know where to turn for care. Are these medical or dental conditions? Now you can offer a place to start. There are a number of reasons why your jaw, your face, your head can become uncomfortable. Some, but not all causes, could stem from a big yawn, eating a rather large sandwich, injuries to the jaw, head and neck, such as a sporting injury, or a whiplash from a motor vehicle collision. We often find patients have sudden onset of jaw pain or inability to open and close their jaw hours after a long dental appointment when they've had to keep their mouth open and hyperextend for a prolonged period of time. We like to consider most of these situations to be a sprain of the jaw joints and associated muscles and ligaments. TMJ disorders is not a diagnostic term, and to use this term with a patient will often heighten concerns of expensive and complicated recovery. It's very similar to labeling an injury whiplash or concussion in terms of predisposing the patient to painful or traumatic condition. We've followed and expanded a traditional orthopedic model of care, starting with a temporary purpose-fit appliance designed to reduce jaw and neck pain and relax muscles around the head, face and neck. Think of this as analogous to an ACE bandage for an ankle sprain, not an immobilizing cast. Unlike an ankle sprain, which involves elevation and rest, the jaw and upper cervical regions are constantly required for swallowing, chewing, speaking, smiling, making it almost impossible to immobilize. Starting with a short-term device might be all the patient needs to heal and return to normal function of the jaw and neck. We recognize some patients may need further customized treatment. The good news is that our immediate program has shown prognostic value towards identifying that patient early, long before chronic problems set in. Quick Splint is a conservative, non-invasive treatment that takes 5 minutes to make. You can deliver it in your office and no dental equipment is required. It is designed for short-term use and has superior performance to a boil and bite appliance. Quick Splint permits the jaw, neck and facial muscles an opportunity to relax by inhibiting the clenching of posterior teeth. Based on our experience and training in orofacial jaw and neck pain, we believe that causing this short-term change in the sensory motor cortex inhibits the previously noxious stimuli progression towards peripheral nociception and pain. Interrupting the pain pathways is important because for some patients, the persistence of pain signals chemically recruits agonist muscles, leading to the expansion of the pain region, increased muscle tenderness, and sensitivity to function. The introduction of Quick Splint and the new associated stimuli has a short-term effect of several weeks before the TMJ, masseter muscles, and periodontal ligaments habituate to the Quick Splint. We do not recommend wearing quick splint during the day because the jaw exercises and self-care measures will retrain the brain to reduce clenching if performed on a repetitive and consistent basis for at least a week. Custom hot-cold therapy face wrap is used to reduce inflammation, to improve blood flow in the jaw and neck muscles, and to provide muscle relaxation. Patients are encouraged to use the face wrap for 20 minutes several times a day to rest, relax, focus on breathing and mind-body awareness, or to use the time to perform gentle jaw exercises. Dr. Fricton has committed his career to providing motivational patient education on how to prevent chronic pain, and through these videos you can be assured that almost any patient question will be addressed. Dr. Fricton introduces the goals of self-care measure in a very educational but also empathetic manner, and he offers practical suggestions for patients to evaluate their progress and focus on positive outcome measures. The jaw exercises outlined are a simple daily exercises that the patient can repeat to help stretch and rotate the jaw joint and restore normal function and range of motion. These exercises should be performed several times throughout the day, at least 6 times per day for 10 seconds. The 4-week care plan, combined with Dr. James Fricton's online videos, offer goal-based directed self-care using small and realistic accomplishments that can be achieved over time when coupled with the start of treatment. This creates successful momentum for prompt return to health. Based on the condition and the relationship with your patient, you can manage and monitor via telehealth or in-person appointments at 2 and 4-week intervals. Again, the key to success is early and tailored treatment, tracking progress, identifying barriers to recovery, and ensuring appropriate care is sought. The good news is that our work and others' work has consistently demonstrated that the vast majority of patients will recover following their trauma and injury and pain. Some will continue to have mild pain reports, but nothing that keeps them from engaging in their day-to-day life and enjoyment of spontaneous activities. However, for a small but certainly not insignificant number of patients have shown a propensity for having persistent problems. We have identified these trajectories, and we are now at a point where we can intervene with confidence on how to treat the patients that are at risk of taking longer to recover. Scenario 1. Your patient wants to do something for the pain, but doesn't know how, when, or why it started. Maybe it was a yawn, or it could have been a simmering condition that became acute and painful. These patients want a quick fix and maybe only need a week of the treatment and self-care in the home healing kit. But you have provided them with a combination of tools to address their condition and become better aware of their oral and lifestyle habits that are risk factors for further injury. The second scenario. An accident, injury, or re-injury to the head, neck, and jaw from a traumatic event is hard to diagnose and treat because each patient responds differently to the tissue damage and the physical and emotional stress associated with injury and disability. When a person is about to crash, their body tenses, teeth and jaw clench in anticipation of impact, the heart beats faster, the breath rate rises, and muscles throughout the body tense. This immediate departure from a homeostatic state has the potential to become set even after the traumatic event has occurred and the threat to self has been assessed. In a sense, this traumatic event becomes part of our post-traumatic flashbulb memory. It is these flashbulb memories that interfere with our ability to relax and return to our pre-trauma state of homeostasis. It is crucial that we intervene quickly to reassure the person that he or she is safe, and the best way to do this is to interrupt the trauma and fear response to reduce, if not prevent, the transition from acute to chronic pain, including post-traumatic stress disorders. The intention of treatment, combined with a focused, consistent self-care plan, is to help prevent a neurological process in response to unremitting pain, to minimize reliance on medication, and to minimize the impact of disability in eating, talking, sleeping, and daily life activities and associated worry and stress. The Speed2Treat Home Healing Kit is based on a biopsychosocial model of care designed to engage, empower, and train patients in reducing lifestyle risk factors that perpetuate disability and thus reduce reliance on costly, aggressive, and unnecessary care. We work with urgent care providers, dental, medical, physical medicine, patients, and family members to help streamline the assessment and informed management of the patient with head, neck, and jaw trauma and injury. Join us in providing this care plan for your patients. Thank you.